sometimes what seems to be inattention or bad behavior is truly just a vision issue. There's so much overlap with a lot of processing issues and vision. Sometimes it's very difficult to tease it apart. But we do want to make sure that these are not just ascribed to bad behavior or poor focus if there's truly underlying eye pathology there. If your child has some misalignment of the eyes that's giving them double vision, and most kids are not going to tell you, oh, I've got double vision. They are naturally going to adopt a head posture to avoid that. Does your child always watch TV like this? Do they always seem to watch like this? That doesn't mean you need to correct them, but it's a sign that you need to bring them in to see us so we can figure out what's going on. I want to start with a personal story, a very personal story. My son is so smart, like really much smarter than I am, so bright, and more than anything, he loves learning, loves to learn. He just feels truly passionate about it. I like learning, and I think I was always a good student, but he just eats it up. He loves learning, and he loves school. And we got this really interesting email when he was in elementary school, and the teacher said, he's just not engaged. He seems to be zoning out. He needs to try harder. Now, of my 3 kids, this is the one that just, he will do anything you ask. His goal is to just make the world everybody just happy. He tries so hard. And so I found this really odd that the teacher would say that he's not focused in class and that he's not soaking up the knowledge the way he normally is, because I might say that about some of my other kids, but this one, no way. And so I knew there was a disconnect. Now, of course, I'm a pediatric ophthalmologist, and I've examined my children's eyes, and I knew that he had a particular eye condition, but I had not made the teacher aware of that eye condition. And because of that, she was making certain judgments about his behavior in the class. So what my son has is something called intermittent exotropia. It's a type of strabismus. Strabismus is when the eyes are misaligned. They can cross in, they can wander out, they can even be vertically misaligned. His were wandering out, which is exotropia. And for some people, they can have it present constantly, or it can be intermittent. He has intermittent, meaning not all the time, which is why the teacher had never noticed it. And when I sat down and talked with him about what behavior the teacher was noticing, he said, they sat me in the back of the class. And when I'm looking at the teacher, sometimes she goes double, and it's just feels really difficult for my brain to comprehend. And he didn't say comprehend, but it just feels difficult for my brain. And so I kind of stop paying attention to what's going on in the front. I kind of look at my work up close, and that helps me see better. And what he's describing is something that's really common with intermittent exotropia is when the eyes are wandering out, the eyes get double. But again, it's intermittent, so the teacher didn't know. I was a bad parent and did not tell the teacher. And so she was making assumptions about what he was doing that was honestly a result of his vision and not a result of his focus or attention. Because that's a really big cognitive load. It really requires a lot of work. People with intermittent exotropia, kids with this condition, they can control the eyes. They can make them straight, but it takes work, and they have to really focus to do it. And sometimes, especially if it's a really far distance object, it's too much and they can't do it anymore. So it wasn't that my son was disengaged with the reading material or that he had bad behavior or that he was losing focus. It's that his eyes could not focus at the targets where he was because of his classroom seating. So that is the takeaway for today's episode. Sometimes what seems to be inattention or bad behavior is truly just a vision issue. If you don't know me, I'm Dr. Rupa Wong. I'm a board-certified pediatric ophthalmologist, been taking care of kids for 18 years, and I have 3 kids of my own. They are 1 tween and 2 teens, and this is a space where I live. I take care of kids in my community. I take care of friends of my children, and I do think it offers a little bit more of an up close and personal look at these kids and what's going on because I know them. I live in Hawaii. Our community is small. I know these kids outside of my office. I see them at the beach. I see them, at the shopping malls. I see them on hikes. So I know how they're interacting with their daily environment. And I know that there's more often to how these vision diagnoses affect kids that sometimes teachers and other people may miss. So first, let's start with some of the common classroom red flags, which might be a vision disorder in disguise. Skipping lines when reading aloud, losing their place when reading, copying words or numbers incorrectly. That can be very challenging for some kids with vision issues. That can also be a sign of a working memory issue. So there's so much overlap with a lot of processing issues and vision. Sometimes it's very difficult to tease it apart. But we do want to make sure that these are not just ascribed to bad behavior or poor focus if there's truly underlying eye pathology there, avoiding books or reading, or if the placement in the classroom seems to affect their focus in the class. Kids with astigmatism may need to sit at a certain spot because maybe one eye has more astigmatism than the other. They don't need to be sitting. It's worse when they're sitting on the right side versus the left side. Kids that are nearsighted need to be up in the front of the class. Kids with strabismus may need to sit up in the front of the class. These are all things that might be a red flag. Avoiding books or worksheets, rushing to turn in the homework just because if they have a vision problem, it's just so difficult to maintain straight eyes. It's so difficult for them to see. Maybe if it's blurry and they need glasses, they just want to get it done as quickly as possible. They may also complain a lot of headaches or eye fatigue or just feel pressure, however they actually do describe that. But these are all signs that there might actually be something vision going on. Tilting their head, either tilting this way or this way, which we call a head tilt, or we call this a face tilt, a face turn. Turning their face these ways could indicate a misalignment of their eyes or astigmatism. And the reason for that is there's 6 eye muscles that move the eye around, 2 that move it horizontal, 2 that move it vertical, and 2 that twist the eye. But each muscle actually has 3 different actions. So when you are in different positions, whether tilting or face tilting, that's activating certain eye muscles. So if your child has some misalignment of the eyes that's giving them double vision, and most kids are not going to tell you, oh, I've got double vision. They just know it doesn't feel right and it hurts somewhat to look at things, or it just makes them feel funny. They are naturally going to adopt a head posture to avoid that. And what they do when they are activating the other muscles, it makes the double vision less. So that's something to watch out for. Does your child always watch TV like this? Do they always seem to watch like this? That doesn't mean you need to correct them, but it's a sign that you need to bring them in to see us so we can figure out what's going on. Because likely I'm going to tell you, let them do whatever head posture they need to keep seeing single and to see well. That is very important. But again, it could just be a guide that there's something going on. Now, why do these vision issues then get misdiagnosed as ADHD or behavioral problems? Well, teachers got a lot on their plates. Oftentimes they are taking care of classrooms of 25 to 30 kids. They are not trained to be pediatric ophthalmologists. I am not trained to be an educator. I cannot do anything that a teacher does. So they're going to miss some subtle clues. So I do not fault the teacher who thought that my child had a behavioral focusing problem, because I didn't do my part in communicating that he actually had an eye issue. These subtle signs, the eye is not wandering out all the time. It's very easy to miss. So the teachers might not be aware of these different ways that some of these vision things can present. And if you've had a school vision screen or even a screen at your pediatrician, they may miss this. Again, your pediatrician is checking vision, one eye than the other, and having them read an eye chart, or doing, sometimes these photo screeners are a little bit better than reading an eye chart. But if they're doing just an eye chart, they're not checking the alignment of the eye. They could be missing intermittent misalignments that could be affecting the way that your child interacts with the classroom and even with other students and with their homework and the reading material. I mean, everything. So Don't just think because they had a good screen at the pediatrician, everything checked out normal, or a nurse checked their vision, that it can't be a vision issue. That's not necessarily the case. And then I think the biggest reason is something that I touched upon earlier. There's so much overlap with vision issues and neurodivergence. There's a lot of overlap with ADHD and vision issues. And then dyslexia in itself can present like it's a vision problem when it's not. There's difficulty with reading fluency. You get the letter reversal. So a lot of parents might think it's vision when it seems to be dyslexia. And a lot of processing problems. The way that the brain interprets the visual system can also be at play. So there's so much overlap between these two worlds. It can be difficult to discern, but we need to make sure that it's not a vision diagnosis before anything else. So what are the specific vision conditions that can mimic a learning disability? First, convergence insufficiency. Convergence insufficiency is when your eyes converge when you look at things up close. So try to look at something up close or ask your friend to do it. You'll notice their eyes cross in. A lot of people have difficulty with that mechanism of convergence. Because of that, that's also linked with your ability to focus up close. So if your eyes can't converge, if they can't cross in, then it's more challenging for you to read things up close. And then kids are going to avoid those things. Their eyes might even wander when they're looking up close. So really simple exercise that I give parents is a pencil push-up, where I tell them to take a pencil. Kids should be able to get all the way to their nose, like a little push-up, and then out again, keeping that pencil single. It's a very easy thing to do. And again, it can mimic a learning disability because kids are going to avoid reading. They're going to rush through tasks to avoid feeling like their eyes are wandering out constantly. Accommodative insufficiency or accommodative dysfunction is something we see also in kids, usually around 7 to 9 years old, and then they outgrow it. So accommodation is your ability to focus up close. Most kids don't have any trouble reading things up close. They are not like us 45 plus year olds, 49, right? Soon. Or 50 soon. Oh my gosh. But when a kid has trouble with focusing up close, they're going to do the same thing. Usually we treat that with a pair of low power reading glasses, and they outgrow it within a year or two. Nothing to be concerned about, but again, something you want to address, because it's not that they can't read. It's not that they have dyslexia. It's that they have a difficulty with focusing up close. So the first one with convergence insufficiency is a muscular problem with the way the eye muscles move to focus up close. The accommodative insufficiency is the way that the muscles of accommodation, which are different, those are the actual focusing muscles, have difficulty. And then uncorrected refractive error. So if there's astigmatism and child needs glasses for astigmatism makes everything look like a funhouse mirror. It can make it look like short and wide or long and skinny. And if B's look like D's or L's because you can't really see it because things are all stretched out, that's going to make a kid avoid doing that thing that seems to be challenging. Strabismus, like my child has, intermittent strabismus in particular, often gets missed. So when the eyes aren't crossed in all the time, but just go in occasionally, which is really common with kids who have something called accommodative esotropia. They're really farsighted. They need glasses to see up close. It's a pretty simple fix and can just boost the reading and the attention in classrooms 100-fold, but can easily be missed because they see 20/20. But they have to work so hard to see that 20/20. And then last, amblyopia. That's when the brain has started to suppress the vision in one eye compared to the vision in the other. And that can affect depth perception. So if you've ever tried walking around with just one eye or tried going down the stairs or doing all the things that you normally do, our brains like to see in 3D. What if you didn't have that ability? Again, it's going to affect that way that the child interacts with everything, classroom and home. There's a lot of research that's shown this overlap between vision and learning disorders, but it doesn't mean that you can't have both. And I think that's really important to know. And one of the studies found that when you treat the vision disorder, their classroom behavior improves. That makes sense, right? Of course, their classroom behavior is going to improve. If they can actually see well, they can engage with the material, it doesn't feel like it's so much work, they're going to be better to their classmates. They're going to be better to the teacher. They're going to be able to focus more. That was actually borne out in the study, the CITT ART study. And so We like data. We like to see it's not just a feeling that kids get better when their vision diagnoses are treated. It's actually been shown. And I want to emphasize that it's not that educators or parents are to blame. The system is not set up to uncover these really subtle visual issues. And that's why you've got to go see a specialist to make sure, if you're concerned, that the first thing we make sure that it's not something we can control. Because if we can control it with vision, with glasses, then we can boost so much. So what can parents and teachers do differently to be able to support our children? So for parents, ask your child about their vision, especially if they're old enough and they've started getting grades and you see a drop in their grades. Ask them if they're having trouble seeing in the classroom or trouble seeing with their homework, or maybe it might even be the fact that there's been a transition from distance to a lot more up close work. That transition naturally happens a lot during elementary school, where it's more classroom learning and then now it's more iPad or computer-based learning. If that seems to be associated or linked with a drop in grades, then a vision issue might want to be investigated. Does the homework take longer than you would expect it to take? Then there might be a reading vision issue at play, whether uncorrected hyperopia, accommodative esotropia, convergence insufficiency, or accommodative insufficiency. Does your child complain of fatigue, just feeling tired when they're trying to do their work, or a lot of headaches at the end of school? This could be another sign that there's something going on. And here's the thing, don't assume just because they have 20/20 vision that they're fine, that it's not a vision diagnosis. As I said, there are a lot of subtle things that kids can have perfect 20/20 vision and still have issues that are causing behavioral problems in the classroom. And you definitely want to advocate for a comprehensive eye exam. I would say even before you get IEP or testing for any kind of learning disorder, just to rule it out first before going down that other path, which, this testing sometimes is out of pocket, it's cash pay, it takes a couple of days. Figure out if it's a vision issue first. And then for teachers, there's just some simple things that you guys can do for educators just to see. And I honestly think that most teachers are the ones that find these diagnoses before the parents do, to be honest. The people that come in, they'll say, oh, the teacher noticed X, Y, or Z, even before the parents do. So kudos to you in handling all of this. Does the child hold reading material up to their face really closely? Do they seem to blink their eyes? Do they squint one eye? Especially in the sunlight, that can be a sign of strabismus. Do they tilt their head or have that kind of abnormal head posture? Do they seem to do worse when they're in different positions in the classroom? Those are all signs that might be there's a vision thing going on and not just a behavioral issue. And then one thing I have also noticed is some kids with vision diagnosis, they can really verbally tell you everything that's going on with math, with science, with everything. But when they're asked to write it down, they can't do it. Now, yes, that could be dyslexia, that could be dysgraphia, but it also could be a pair of glasses. And a pair of glasses is a lot easier to treat than the therapy that's required for dyslexia or dysgraphia. So always want to rule that out first. And as a parent of 2 kids with ADHD, I think a lot of kids have a lot of internalized shame about their performance in classroom. They're looking at their peers. They may be worried about having any kind of learning disorder. But if we can find out if a vision disorder is also at play, that's really, really important to discover. And so when you're at the eye doctors, here's a couple questions you might want to ask. You can ask them, did you check for conditions like intermittent exotropia, like my son has, or accommodative esotropia? These are conditions which can really affect reading or even distance vision. And sometimes they can be fixed with just glasses and even some eye exercises if it's a convergence insufficiency type. Did you use those dilating drops to check for farsightedness? If they didn't, please see somebody else, because that means you did not get a comprehensive eye exam. And they cannot tell you with 100% certainty that your child's eyes are fine. And always when you come in, give us the full history. That really helps us, because if I'm examining a child and they have a normal amount of farsightedness for their age, I'm not going to prescribe glasses. But if you tell me your child is complaining of headaches and eye fatigue and eye strain only when reading, then I am going to give a very low power reading glasses for accommodative insufficiency. So that history really, really matters. So don't be afraid to tell us what's going on and how your child is doing in school, or what the teachers have noticed, or what you've noticed yourself. I know that a lot of this can be really overwhelming. There's so many forms to fill out and appointments to make if you're considering a diagnosis of a learning or a processing issue for your child. But just take a minute, and I think if you ask yourself these questions, it might uncover something that's in addition to or instead of the processing issue. And asking these right questions can really shift the whole picture, because if the vision is part of the problem, then correcting that can just make a huge world of difference, or even at least explaining to the teacher why they're seeing what they're seeing with your child. I mean, I didn't do surgery for my child. He has perfect 20/20 vision, but at least explaining to the teacher, all right, you're going to see him look like he's spacing out. He's actually not spacing out. His eye is wandering out. And then he needs to look at something up close to reset the eyes. That goes a long way. And most of us are happy to write those kind of letters if you need. Well, that's it for today's episode. Thank you so much for joining me today for In Focus. If you've got a question or a concern and you would like for me to address it on a future podcast topic, please send me an email at hello@drrupawong.com. Until next time, bye for now. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong, or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.